population specifically, and will share her details of her passionate work with us. She also really aims to arm children with necessary skill sets to be happy and thriving at school, home, and within the community. Thank you, Sakina ma'am. Munira bin Shakir graduated with Bachelor's of Science in Biology from St. John's University in 2005 and a Master's degree in Occupational Therapy in 2007 from Midwestern University in Illinois. She has since worked in a variety of settings, including outpatient pediatric schools, acute care, orthopedics and neurology. Munira has experience treating a range of diagnoses, including autism spectrum disorders, sensory processing disorder, neurologic disorders, ADHD, developmental delays, and many others. She lives in the western suburbs of Chicago. She enjoys spending time with her 3 kids and volunteers every Saturday at the Madrasah working with kids with special needs. In her free time, she enjoys, I don't know how you have free time, but enjoys indoor rock climbing and recently has become a private practice owner, which is thriving. So thank you very much for this talk, and looking forward to it.
I also like my children. I didn't put that in the blurb. Sometimes I like them, sometimes I don't.
Okay, so we today are going to be talking about inclusivity in the madrasa setting, and Munira will definitely hone in more on that part as she has started initiatives in the Chicago Jamaat. But we both will talk about our specialties today as it relates to the special needs communities. So our population that we specifically work with is autism and ADHD. I work more with autism population, but oftentimes there's a comorbidity of ADHD. So what is pediatric autism disorder? It's a developmental disorder that affects communication, behavior, social interaction, and it's typically diagnosed between the ages of 2 to 3 years. And early intervention is extremely important in order to improve the quality of life as they age. So the criteria for autism diagnosis is deficits in social emotional reciprocity, deficits in nonverbal communicative behaviors, and in developing and maintaining and understanding relationships. So we see deficits in the social settings and communication with others, as well as like in peer relationships and things like that. In addition, those diagnosed with autism often have repetitive motor movement or speech, inflexible adherence to routines or ritualized patterns, fixated interests that are intense and highly focused. Like I once had a child who knew the whole New York subway system back and forth. Like he could tell you if he wanted to go from one place to another exactly which trains to take. So that like very intense interest. And then hyper or hypoactivity to sensory input, so sometimes overstimulated or understimulated. And then we'll move into attention deficit hyperactivity disorder. So this is a neurodevelopmental disorder, shows persistent patterns of inattention and or hyperactivity, impulsivity, typically diagnosed in childhood and can persist into adulthood. And like I said, there's often a comorbidity with autism. Just as a show of hands, can you raise your hand if you have anybody either in your family or in your friend circle or in the Jamaat that you know has been diagnosed? Yeah, it's a pretty high prevalence rate, and we'll go over the prevalence rate of autism, but we're seeing it a lot more.
I can go over a little bit more of the ADHD portion. So children with ADHD, you won't tell as much as a child with autism. ADHD is more behavioral. It comes out when they are needing to be more mentally challenged. That's when those symptoms really come out. So we will often see these things, especially in an educational setting, but we will all automatically assume, well, समझ नहीं पड़ती कि आप बच्चू जे छे ई सुनतो नथी. He's automatically deemed as the bad child in the classroom. That's often not the case. ADHD, as you can tell, it makes careless mistakes in schoolwork. You have difficulty sustaining attention in tests or play, does not listen when spoken to directly. Often, just like a child with autism, they will have trouble maintaining visual attention, so they may not be making eye contact, so it's not that they're being rude at all, it's just that they can't maintain eye contact for very long. Does not follow through on instructions, difficulty organizing tasks. So as you can tell, all of these things that we're saying, these all can come up in an educational setting. They can come up in madrasah, and we are assuming that they're just not wanting to listen. But it could be a diagnosis that's being missed. Avoids to engage, often loses necessary tasks, easily distracted or forgetful. So what I want to bring across here is just that oftentimes I think that there is a need for education, not just amongst parents, but also amongst the teacher staff in an educational setting. I think that we have that here in the American system, but I think it lacks in terms of our Jamaat in our community. And so I think what happens is when a child feels that they are not being understood, it causes them to not want to come. And that is what Sakina and I are here to kind of bring forth, how to be able to more recognize these things in our children and to get them help as quickly as possible, rather than them being completely ignored in Merum Rejai.
No, he's asking if it's the same degree or same affliction between the two, and it's different.
It is different.
So autism is specific in that they lack the skills across multiple domains to be functioning in their daily life. So those domains include socialization, communication, and
motor deficits.
Motor deficits.
Speech and language deficits, whereas a child with ADHD, you may not see speech and language deficits, but it's more in their executive functioning and their cognitive abilities to put forth in a task. And so that's when it'll come out, those symptoms.
Does that answer your question?
Yeah.
Okay, so the prevalence is quite high now for autism. So it's 1 in 36 children are affected in the United States. And the prevalence for males versus females is higher, so it's 1 to 4 is the ratio. And it's thought to have increased because of environmental factors, but also due to the recognition of the disorder. So more and more people being educated and aware, and so those diagnoses are happening more frequently. And then ADHD, the prevalence is estimated to be among about 11.4% among children ages 3 to 17. Again, prevalence is higher for boys versus girls. Girls typically get diagnosed with ADD more than the ADHD, so the hyperactivity piece isn't there as much as just the deficit in attention. And then some of the symptoms of possible disabilities of children within the educational setting. So these are like some of the red flags to look for when you're seeing children who may not be complying or may not be comprehending within the madrasa classroom setting. So things with
their behaviors
off too.
It may just be a larger story than just being misbehaved.
Yeah. So difficulty with academic tasks, poor attention and focus, behavioral issues, motor skill delays, language and communication, and social difficulties. Munira, you want to take it?
So, how many people in the audience actually know what an pediatric occupational therapist does? So not very many. How many, in terms of any physicians in the audience, how many people have referred out to occupational or speech therapy? Not really knowing what they do, but knowing that they'll help. For pediatrics and adults. In terms of occupational therapy, what we work on is we help these children, the children that are showing motor delay, cognitive delay, and are unable to participate in their daily occupations. So when you hear occupation, it's not necessarily getting them a job, it's about their daily occupation. So being in madrasah and being in a school setting, that is part of their daily occupation. That's what they do for 8 hours a day, etc. And so what happens in the school system is they get evaluated, parents come in, they do an entire sit down for an individualized education plan, an IEP, and they create goals. An OT comes in and will make those goals so that they bridge the gap for the education piece, the curriculum. So what we do is the strategies we use are a lot of sensory integration strategies. Like Sakina bin said, they may be understimulated, overstimulated. What can we do to help that? Adaptive seating, if they are what we call stims, that energy overflows, and so you'll see even through anxiety is also a comorbidity, through anxiety, through just your neurons overfiring. You will see children flapping. You will see children fidgeting. You will see. I think that we forget that even in adults, I have the habit. I shake my leg, but my roommate Patulbin had noticed that. It's because we have these habits, but as functionally capable adults, we know how to work around our habits. These children are having a harder time. They need us to help them understand what they need and what their bodies are asking for. We often use visual schedules. Children who are on the spectrum or with ADHD are often considered to be visual learners. So if we're talking and we're talking too fast or too much or it's very wordy, which often is the case in madrasah because we have this much of a curriculum to be taught in this much of time once a week, teachers go fast. And a child will be processing the first thing that you're saying, and you're already on like stage 4 or topic 4, and they're still processing the first sentence that you said. So offering more visuals, we do that so that the child can stay on task and stay on topic easier. We offer fidget toys, and we just, again, for that motor piece where if they just need to hone their energy into something so they're not getting up and walking away or needing that or distracting the rest of the class, things like that. And social skills training, which we actually refer a lot to speech and language as well as Sakina bin's profession and expertise in that behavior component. So I just wanted to highlight some of the pictures of things because, when we say we're using all these strategies, sometimes it's hard to be like, well, what are you doing? We often use something called like a sit and move cushion. If you put this on your chair and sit down, it offers some input. The child can just kind of wiggle in their seat. They don't have to be disturbing others in their classroom. And you can even kind of sit on it if you want to kind of move around. You can get a feel of it. It helps children with ADHD kind of just get that motor input in without disturbing anyone. We also offer different seating options, a wobble stool, we often offer, I'm sorry, I'm just looking at Olivia using the weighted blanket here. We use something called a TheraBand at the chair. It is a stretchy material that we put right at the base of their chair so they have something to kick on. The object here is to be able to provide that motion where they're already sitting so that they're not disturbing the rest of their classmates. For children who are with autism, also they need structure. They are processing things at either a slower or a faster rate than everyone else. And so for them, we need to have clear-cut structure. Something as easy as putting a spot on the ground when we're doing circle time can make a world of a difference for a child. When you're telling them to sit down, it is sitting on an open ground is too hard for a child on the spectrum. They need structure. They need to understand. They see the floor and they see a big floor. They don't see a small spot. They can't understand what it means to be in. You have to provide the structure. They can't visually provide it to themselves. So just offering a spot, or a cube chair, something where they're contained. We have tons of fidgets here, which you guys are more than welcome at the end. Everyone can come up and just kind of feel on stuff, but we offer a lot of those things. Anything that can help, like I said, to offer the child some motor stimulating stability within their space. We have children who like to bite. Autism spectrum, they are seeking more oral motor input. That's where that biting comes from. It's not because they are a bad child. It is not because they don't understand, and that's how you have to understand some of these children are nonverbal or limited with their ability to speak. So they will communicate in any way possible because expression is hard. So if it means negative or positive attention, is still attention to these children. So what they will do is they will bite. If biting someone or biting a pencil or something causes someone to give them that attention, they will continue to do it. It is a feedback loop, which Sakina will go into more. We use visual timers, and we also often use a compression shirt, which I use a lot in the Chicago Jamaat. I have recommended this to a lot of children. It's a very tight fitting t-shirt. It gives them some input. It gives them like they're being squeezed and held. It makes them feel calm. Their nervous system calms down. It is worn right underneath their saya kurta or jablaizar, and it makes a world of a difference.
And also, a lot of these strategies that Munira is talking about can be used with neurotypical children as well. So like a lot of our younger learners and atfal and awala and ibtidaiya, and you see this in elementary schools, there's so much adaptive seating in just the regular general education classrooms. Like I know my kids have wobble stools in their classroom, just there. So if they want to choose that, they have the option to have that. And so a lot of these strategies can help with our younger learners who already, they don't know what to do with that overflow of energy, and we often like toko them to like sit nicely in madrasah, but they need movement. They learn better sometimes. They're able to focus better when they get that feedback from something else, by having a fidget or by being able to move in their chair without being yelled at. So like this is not just, some of these strategies are not just specific to autism and ADHD.
I recognize a lot of these tools are probably very specific to individual kids,
right. Yeah.
Maybe, but you're talking about the attention deficit as they get older with autism. Is it possible for any of these things to distract the kids from the actual task of learning?
Great question. So I think you also tapped into a little bit of the answer. It depends on the child. It depends on what is needed. I have a child who currently is very brilliant, but she just has this need to move because of this overflow in her neurosystem, and so she just needs something to squeeze on, and it keeps her calm. So I think it's an individual case-by-case basis.
And some of it is trial and error. Sometimes you don't get it right, and then you see like, okay, their behavior is increasing, and we'll talk about this when we hit ABA, but we take a lot of data, and so then that data informs how to move forward. If we've implemented a strategy and the data show that the behavior has increased in magnitude or in frequency or in duration, then we'll pivot and we'll change something. So it's not just willy-nilly. Yeah. Yeah.
I've never seen anything like this.
No.
And I don't know if there's maybe I've come from a small town, nearby, and I know bigger towns in the Madrasah, they have a lot of these strategies that's maybe mentioned.
So we stay tuned. We're going to get to that. Thanks, Burhan Bhai. So alongside with OT, I work very closely to speech-language pathologists, and so we use a lot of those strategies are hoping to be using some of those strategies as well in our madrasa setting for our neurodiverse children. We use a lot of visual supports. Speech is all about visual. Kids are nonverbal, or kids have limited speech, so whatever we can do to help them increase their expression is what we do. So Sakina will kind of show you the things that she'll pass around, what we use in terms of a visual schedule, in terms of being able to provide children with the pictures and the tools that they can use to just communicate what their needs are. You will see a rapid decline in negative behavior when a child is able to express what they need. So similarly to the other slide, just showing you some pictures. So we offer, and especially in the Chicago Jamaat, I do run a contained classroom there, We use a lot of pictures. Obviously, these pictures are standard. I got off of Google, but we do have pictures that are more madrasa-based so that the child knows what's coming next. Children who are neurodiverse have a lot of trouble feeling in control. They're not in control of their bodies. They're not in control of their language. They are just feeling not in control of a lot of things in their environment. So by providing them a schedule and providing them pictures to show, they feel like now the control is back in my hand. I am feeling like I am ready to learn. We use a lot of first then strategies, and we often, this is something that I created for Wazoo. Children love, on the spectrum and ADHD, they just love Velcro. They love the feel of Velcro. It makes them feel good. They like to learn that way, and so we adapt the curriculum to what they need. So same thing, I've already kind of talked about this. I'm going to keep going. The other strategies that I have, so this is my madrasa classroom. We have about 5 kids on the autism spectrum, and 3 children with ADHD that we're helping. Alhamdulillah, we do have a madrasa building now in Chicago, so we were fortunate enough to have a contained classroom. Prior to that, I was kind of in a hallway, but we made do. So these things can be done no matter whether you have a classroom or not, is what I like to say. Yeah. So all the special needs children, they don't, regardless of age, we understand that they are probably not, as far as learning is concerned, they're probably either at or similar to their same level. Correct. So our hope is that we can take the meat and potatoes of the entire curriculum from, let's say, starting Ibtidaya or Awala all the way to like Rabia Khamisa, where we understand that many of these children may not be doing Ashara level, Sabak level, but our hope is to at least get them included, feeling like they have their basics down, and our goal is to have them be prepared for their Nisab exam. Ilogane namaz, wazoo, ilogane, basic surat, memorize karwanu. I have a child that is as low as not understanding ke had jorwanu. We're also working on just getting a topi on his head because of issues of sensory issues. So we have everyone in the classroom. We do circle time. We do the basics, everyone together, and then we kind of have breakouts. We're fortunate in Chicago that I have trained other Beirao who are helping me now to be aides, and so they will help to break out those sessions and do one-on-one individual, where that older piece might fit in because everyone is not at the same level in terms of like their, what they're learning or what their capability is, but we do tailor to each child based on their individual goals. No. The children feel, at this time, the children just feel accepted because they feel like what they need is being offered to them. No.
And oftentimes in school, all these children have either an individualized education plan or a 502, which offers them accommodations and modifications in their school setting. So they're often anyways in a special education classroom, or they're being pulled out for resource time, so areas where they need specific help, they're being pulled out of the general education classroom. So it's not starkly different from something that they're already coming into contact with 5 days out of the week. And I think in addition to learning the basic madrasa skills, they are getting social skills, right? They are meeting with other bachao. They're probably having lunch with other bachao. They're probably praying namaz.
So we do that everything together. Hame loga ka snack to time thai che, we sit down and apne bachao ne kahe che ke something as simple as I bring up a sentence. Maru favorite color lal che. Okay, mane lal ganu pasand che. Then we go to the next child. he will repeat what I said, or I will bring out a visual and say, Maru, favorite color, Amjad. The child will repeat it, and then he'll give his color. Then he'll go to the next person, and they will feel so confident that they are socializing and everyone is feeling like they're a part of something. Oftentimes when we try to have these children go into a general classroom, they get so isolated because they are different. And so the children who are learning at the neurotypical level all are on one side, and this child is just considered the child who is distracting.
Just one very quick comment. आज exactly ये section में दावी पूछे कि कब separate करो जो काम लोगों ने दर्जा separate करो तो I think that's what home is bad because अपने school community mind से कि हमारे बच्चों isolate ना થાય हमारे बच्चे अलग ना लागे they don't get the help that they need and especially madrasa अंदर जिस अपना बड़े जिस excellent teacher और से अस्पताल में volunteer किया है they're not experts in this situation. So ये लोगों ने अगर mainstream classroom में आपको they won't get this type of help.
In order for you to implement this, do the parents share their diagnosis or their situation?
So we'll get to that at the end. Yeah, we will. We'll
Great
address
question.
all of
We're
those.
going to get to that.
Half hour. Okay.
Well, not always, and I agree with you, Amina, but not always, and this is why we need to understand because there is a stigma. So often parents will not disclose because of the stigma, and B, sometimes there are just small things and mild issues or mild limitations that are just going unnoticed, and the doctors are often unnoticing them. Oftentimes, Sakina and I, in our profession, will notice something before a doctor will because we're just trained. Our eyes are trained in it, and so what happens is it goes missed, and then the child is just struggling in madrasa over and over. What? Louder? Sorry.
I would expect that with the teachers in madrasa, you may have an environment where kids get in trouble or they don't
Correct.
get the teaching that they need because of their issues.
It just kind of, and especially in our community, unfortunately, it goes into the negative box automatically.
Parents even that are just in denial that their
Yeah.
child is different.
Correct.
There's a lack of awareness.
And we feel, Sakina bin and I feel that if we bring this topic to to attention, what happens is then those parents will now not be feeling scared to come to one of us because now we're normalizing it. There's no more stigma. Just like mental health is starting to slowly be normalized, we are hoping that special needs gets slowly normalized as well.
Can I share one experience?
Yes.
I have a nephew that is now in his 30s, and he's got autism. He's got Asperger's. 30 years ago, when Asperger's was around, he did not, it wasn't really that much heard of on the spectrum. And he didn't live in the U.S. I remember, we thought something was off, just because I think we're more around a medical setting more in the U.S. and are more accepting of special needs and things. But when he was about 10, there was a big article in Time magazine about autism and Asperger's was coming up at that time. I remember giving it to his parents, and they were just stunned that I would even think their child had something wrong. So, you do your best. You're 10,000 miles away, and you can't really do a whole lot about it. To make a long story short, he was doing terrible in school. Kids are bullies because they don't know, right? Children are just children in some sense, and when you put them in a regular classroom setting, it doesn't work for them. He ultimately, they switched schools thinking this was a bad school. I used to tell them, go seek some help. When they used to come to the U.S., I'd say, let's go take him to a doctor. They didn't want him diagnosed at that point. But anyway, when he switched schools, he got bullied again. He got so infuriated, he took a pencil and jabbed it into a kid and put the pencil through. When he did that, the school kicked him out, right? And said he needs to get help. That's when he finally got diagnosed. So moving forward, I got him into a college in the U.S. When he came into the college, he went to one that is specifically for arts because that was his passion. So we got him in, and I went to the school with him for orientation. First day I went, every kid was like him, right? They were all into anime, this art. I'm not that person. I'm a very social person, but I'm not that art, anime, creative person. I finally understood because I was the outsider sitting in that classroom and knew what he felt all along because he walked in. He could talk to this kid, he could talk to that kid, he could talk to this. I'm standing there having no idea what they're talking about.
They had all of this in common.
And I think I worked in helped in Madrasah for many years, and that is what I think we have to teach our children. Yes, we're far more accepting than we were 20 years ago about even Madrasah, but they're not bad kids.
Yeah.
And teachers, unfortunately, a lot of our teachers are volunteer, and in the smaller jamaats, they're very limited teachers with access. So we need to have them maybe trained by you guys.
Yeah. So thank you, Rashida, for sharing that. That actually means a lot to me. We're going to just keep moving forward. We're going to try to keep questions to the end now because we just need to keep going. I'm going to just kind of briefly go through all. So there are different assessments that I personally use that we can use during our Madrasah registration process. It will help us understand the child better. We can understand and gear a curriculum or a goal for those kids based on what their specific individual needs are. It is not tough. It's just a questionnaire that we use for their sensory needs and then as well as their executive functioning needs. I'm going to let it go. No, so we'll get to that at the end. Thanks.
Okay, so I'm going to talk about what I do, which is applied behavior analysis. Is there, by a show of hands, is there anybody who knows what ABA is? Yeah. Okay, can anybody define what ABA does or tell me what ABA does? That's what I thought. Okay, so a lot of people know what it is and will refer out to ABA specialists, but they don't actually know what we do. So it's a scientific discipline concerned with applying techniques and principles to bring about meaningful and positive changes in behavior. It's used in a variety of settings. We provide services in home, in school, in the community, and at its core, the purpose of ABA is to bring about socially significant change in our learners' lives. And what is socially significant for one individual may not be the same for other individuals, as well as what's important for socially significant for a family and their cultural values or their ethical values or social values will vary. And so we work around what is socially significant for that particular individual and create programs based on that. Okay, so the core principles, the first is behaviorism, which focuses on observable behavior. So we're not looking at internal states or mental states as much as we are looking at physical observable behavior. So for example, for a child who presents with anxiety, we're not looking at them to tell us that they're anxious. We're looking at somatic changes that show us. So fidgeting, like Munira was saying, she shakes her legs as a nervous tick-ish. Getting flush in the face, the stammering, pacing back and forth, all the things that I'm probably doing right now. All of those are shows of anxiety and not them telling us that they're anxious. And so we look at those observable behaviors. And behaviorism is seen as a function of its environment. So often we see certain behaviors in certain environments and not in other environments. For example, we see our children act extremely rambunctious at home. Huzaifa and I were talking about this at home, where they'll give us attitude and they'll talk back to us at home, but when they go to somebody else's home, they inhibit all of that. And so what they're doing in one environment is different than in another environment. I'm sure you guys hear all of this at parent-teacher conferences, how lovely your children are, how wonderful they are, and we're always, our jaws are on the floor because we just can't see that. Another core principle is reinforcement. And so we have positive reinforcement and negative reinforcement. And this is often can get confusing, but positive reinforcement is the addition of a stimulus to the learner's environment that will increase the future likelihood that that behavior is going to occur again. So when we are looking to teach a child something that we want them to do, so a desirable behavior or an adaptive behavior, we are going to implement the reinforcement strategies up here, like positive and negative reinforcement, in order to increase the likelihood that that behavior is going to occur again in the future. For example, we have, I think that the token economy system is a example of positive reinforcement. So when said learner does preferred behavior, we give them a token, and those tokens, when earned, will allow them access to something that they really like, whether it's a preferred food item or a tangible or an activity or attention. They're working towards a bigger goal, and so that is an example of positive reinforcement. Negative reinforcement is the removal of an aversive stimulus. So something that the learner does not like is removed from their environment in order to increase the future likelihood that that desirable behavior will occur. So I have an example that Arva turned in her homework late or incomplete for the last 4 weeks. Every time her homework is late or incomplete, she has to do an extra writing assignment. However, when she turns in her homework on time, that writing assignment is removed. So that aversive stimulus is removed. So we're trying to increase the likelihood that she will turn in her homework on time in the future. So that's reinforcement. And then the next is punishment. And so there's positive and negative punishment, but really punishment is punishment principles are employed in order to decrease the likelihood of a future behavior occurring. So these are typically used for undesirable behaviors or maladaptive behaviors. We never really use this is not. We don't really employ punishment ever alone, especially. So we try to avoid using punishment principles, and we try, if we do need to use them, then we will use punishment as well as reinforcement, because all punishment does is teach them what not to do, but it doesn't teach them what to do instead. And so a lot of times we'll tell children in Madrasah, like, I don't know, give me an example, Munira. Like if they're fidgeting,
they're
stop
sitting still in their chair and they're moving around and distracting other kids. So we're reprimanding, which is the addition of an aversive stimulus to decrease the likelihood that they'll move, okay? However, it doesn't teach them what is the adaptive behavior. And so we can do that, we can tell them what not to do, but then we also need to teach them to request an adaptive seating for themselves. Okay, I feel really fidgety right now. What can I do instead? Can I have a wobble stool? Or can I have a cushion to sit on? And then we reinforce by giving them access to that, and then also telling them, like, thank you for telling us, right? Like, thank you for using your words. Or thank you for telling us what your body is needing, and so I can help you.
Yeah.
Basically expressing that, because no teacher is a mind reader.
Sorry, I keep losing track of this. Okay. The next thing that we'll go over is the antecedent behavior consequence model. So this is known as the ABC model. So whenever we're looking at a behavior problem, we need to assess what happens before the behavior as well as what happened after the behavior to understand why the behavior is occurring. There's some examples here. A child is told no when wanting a toy from the store. That's what happened before. So child asked for a toy, child was told no. The behavior is that the child screams, cries, throws themselves on the floor, and the consequence is that the parent buys the child the requested toy because they want to avoid the embarrassment in the toy store, and so chalo toy lelo. So what's going to happen is that the parent has positively reinforced
the negative behavior,
the maladaptive behavior. And so in the future, when they go to the toy store or any store and the child wants something, they know I can have a full-out tantrum right now and I will get said item that I really want. Another example is Vazma Mola Farmavish ki bachao garma lisana dawat bole. माँ बाप बच्चाओं સાથે ખાલી લીસાના દાવતમાં વાત કરે અને બચ્ચાઓ વાત સમજી શકે છે. So this is an adaptive behavior, right? We are what's coming before is that parents have gotten this feedback, parents are speaking lisana dawat, and now the consequence is that the children understand better Vaz, and so parents will continue to speak in lisana dawat because their children are understanding, and that is the positive reinforcement for that behavior. Okay, assessing problem area. So ABA is the only evidence-based scientific approach to changing behavior. It's used across a variety of different settings, but most successfully has been used with the autism population. But people use this with animal training, people use this in organizational behavior, so, big corporations, the principles can be widely disseminated.
And just to say, I wanted to add in just, we are talking about the special needs community.
Yeah.
But a lot of what Sakina is saying, we can also just implement on a wider base in Madrasah, just as part of like parent teaching or teacher education that they can use in their learning techniques in general with even neurotypical kids.
10 minutes? Okay. With our learners, we teach across a range of domains, so academic, communication, self-care, motor skills, and social skills. I'm going to skip some of this. This is an assessment that we use. It's called a functional assessment screening tool, and this can be given, we can use this in the madrasah setting to determine why a behavior is occurring. So if we see a specific behavior happening, this can be disseminated to parents as well as teachers, and it asks a variety of questions that then scores to tell you what the function of the behavior is, which I'm going to go to next because I think that is important to hit really quickly. So the functional behavior assessment identifies the causes and function of behavior problems. So it defines what the specific problem behavior is by taking data, like I was telling you, Murtaza, we take data on the intensity, the frequency, the duration of a said behavior. So if we're looking at tantrum behaviors, we look at how long is that tantrum behavior lasting, how frequently is it happening, and then we create a treatment plan based on that. When you're looking at the context, you want to observe the environment in which the behavior occurs, and then examine, like we said before, look at that ABC model. So what's happening before and after the behavior. The 4 functions of behavior. So these are the 4 main reasons why any behavior occurs, whether you're an adult or you're a child. There are some others, but these are like the main 4. So the first is escape of an aversive. So you're escaping a demand or a task. So, when a child is given a homework sheet and it feels really overwhelming, they may start acting out. They're acting out because the task is too demanding for them, or they're feeling really overstimulated by how much they have to complete, and so they engage in a maladaptive behavior as a function of trying to escape from having to do that work assignment. The second is gaining access to a tangible. So this is like a preferred item activity. We talked about the toy store. That would be access to a tangible. The next is gaining access to social attention. So wanting mom and dad's attention, wanting teacher attention, wanting peer attention, not getting it in the way that they want it and when they want it. And then the last is self-stimulation. So this is like where Munira's profession comes in, teaching them how to access, because they become very overstimulated, easily or understimulated. They can engage in maladaptive behaviors like biting in order to gain that stimulation.
I just wanted to add really quickly for the escape of the aversive, like what she said, when they are given a worksheet, it is so overwhelming sometimes when they're looking at it that they're overstimulated by just the amount. And so an easy way to adapt that for that child is to lessen the amount or add pictures. That's what we do. As an OT, we can go in and we can look at the assignment and we can adapted so that it's more positively accepted by the child.
Okay, and these are just some skills. So we're talking about maladaptive behaviors. These are skills that we can teach the children in order to inhibit those maladaptive behaviors. So these are our replacement behaviors, teaching them how to communicate their wants and needs, whether that's with visual supports or just giving them some basic words or signs to be able to tell us, like, we're all done, we don't want any more, or we want more of something. Learning how to gain attention appropriately, engaging in leisure activities so that they're not maybe like ripping apart threads of their sayakurta. What can they do as an appropriate leisure activity instead? And then coping skills, how to cope with any, overstimulation, understimulation.
Right, or just negative feedback from the outside.
Yeah.
Kids get their feelings hurt. How do we cope with that?
Okay, really quickly, we've touched on a lot of these things, and so I'll just show you the slides. But so when we're looking at a behavior, we're looking at the antecedent and the consequence. So when we're looking at changing a behavior, we're going to either we can do both, change the antecedent environment as well as the consequence environment. So here are some strategies like environmental modification, putting a child at the front of the classroom so that they can hear what the teacher is saying better, clear expectations, providing very clear-cut rules of what is expected from them in their madrasah day or in their school day, behavioral cues and reminders like the spot on the floor for where to sit, structured routines, positive reinforcements, choice making. Munira then touched on that. It's important to allow our learners, if they can't make just a general choice of what they want, giving them at least a controlled choice. So giving them two options of what they can choose and let them choose one of those. They're more willing to participate and engage and will also feel like they're advocating for themselves. And we want to teach them that skill. Task modification, Munira then touched on that, reducing the demand. Antecedent manipulation, collaboration and support with the learner, again, teaching them to advocate for themselves. And then we have consequence strategies. So 5 minutes? Okay. Guys, the time. Consequence strategies, we talked about positive reinforcement, positive and negative reinforcement and punishment. So changing what we do from a consequence end. No matter what happens in that toy store, that child is not going to get access to that toy, but we can tell them what they can get instead of that toy. And that extinction is also part of not giving them access. So we're not letting them have access to the function or what is maintaining that behavior based on the problem behavior. We're extinguishing that behavior. Token economies, we pass that around. And behavior contracts. This is a behavior contract with Taha and Fadl and myself. It is on his door, and he got tired of writing. He was like 6 when we did this. It's still up on his door. He has very explosive tantrums, or had very explosive tantrums, and so this was like a little contract between us. It was signed and dated, and we refer to it every now and then. Still. Okay.
So basically, Sakina and I are here to ask for a call to action. We are looking upon our doctors who have a lot of influence in the greater Dawoodi Bohra community to be able to help us get this across the board. We do have this, I guess we can say, a pilot program here in Chicago where we do have our contained classroom. It's been working really well. Alhamdulillah, I've been able to train others to kind of understand a little bit about the ABC strategies and a lot of the OT strategies that we use, and I'm there obviously to refer back to if something is needed. But we have been able to kind of identify we have 5 children now. We've been able to identify each child's learning ways of learning, what they are limited in, and where they are currently in their madrasah, education, and where they need to be. So, number 1, revamping annual madrasah registration. We feel that when madrasah registration occurs, it is important that at maybe prior to that time, teachers can come to us and let us know, these are the red flags, these are the list of children from each daraja that we have red flagged. Is it possible to reach out to a parent and see if there is something that we can do to help? The other thing is we need to educate our teachers in order to understand these red flags and also to lower the stigma of the fact that a child may have a diagnosis or may be limited, cognitively or, and maybe neurodivergent, and understanding what that means. I think Rashida bin Bakswala, she definitely pointed out that oftentimes, and I know I've seen it in our madrasa, children are actually very receptive to the children that are neurodiverse. They're kind, they know to be kind, and it's normalized now in schools. They see it. I think it's time for us to maybe educate the older generation who are in the positions of leadership and make them understand that it's, we need to lower the stigma essentially. Educating all of that during annual teacher trainings. We do want to put out there to families that if they do have an IEP or a 504, 502 in school to come and disclose that in madrasa. Give us the paperwork. What are they doing in school? How can we maybe, not exactly, but be able to kind of have similar or mirror that in madrasa as best as we can. And that I know parents are worried about people finding out or everybody knowing. In schools, it's very confidential. There is a signed document to keep that privacy there. We can completely do that here, where things are signed and there is a non-disclosure that this will not be outside the realm of just the 5 people that are involved in your child's education here in madrasa. So ensuring confidentiality and then having monthly check-ins. We understand that what Sakina bin and I do may not be present in every jamaat, but we are here to offer our khidmat, that we can be able to zoom in. We can be able to take that data from all of those questionnaires and be given it to us, and we can score them and we can interpret them and then help the madrasa muallim to understand those children. And then we can come in as a team to train those other individuals that that muallim can then say, hey, these guys would be, Bayo and Beno can be good to train. They're willing to help. We can come out and do a training session, something like that. So monthly check-ins. And that's just a little bit of a corner of my classroom. Designing a classroom. When we designed the madrasa classroom in Chicago, we thought about an all-in-one flexible curriculum that's needed, which I talked about a little bit. We take a generalized curriculum. We take the full curriculum for Awalad all the way to maybe Rabi or Hamida, and we take out the meat and potatoes, and we create one curriculum, and that is the child's entire curriculum for their entire journey in madrasa, start to finish. Wherever they leave off is where they start back the following year. A space created to increase their visual and sensory needs, and then obviously mastery based based on their child goals for the child.
I also wanted to point out that there's also initiative in Houston Jamaat. Lubina bin and Jamila bin Mogri are doing some really incredible work over there as well with specific special needs children. So it is happening in more than,
I think we can go to the next slide.
I wanted to share that in New York we are doing the exact same thing too. Understanding we have a teacher who works with special needs as a so she's helping us.
We just wanted to highlight one specific family. This family has a child. He is 9 years old. She'll let you know in the video, but she just wanted to share this video to explain her experience.
We had 1.5.
Volume. Pause. It's on a touch screen.
Oh, it's on.
Uh-oh. Is there I can put the mic somewhere? Can I put a mic by the speaker?
Do you want to play from my computer? just so everybody can hear it. From my phone.
It's on my son, Shakir. I share a story about him. Shakir is 8 years old and has a diagnosis of autism. Alhamdulillah, that is a very happy and sweet child, and we are truly blessed to have him in our lives.
I'm just going to play it from my phone, if that's okay with anybody. Yeah.
Shakir is doing well academically, Alhamdulillah. Currently,
Okay.
I'm here to talk about my son, Shakir and share a story about him. Shakir is 8 years old and has a diagnosis of autism. Alhamdulillah, Mulani Duasi, he is a very happy and a sweet child, and we are truly blessed to have him in our lives. Our goal is to support him in every way possible and help him succeed. Shakir is doing well academically, Alhamdulillah, currently in the 2nd grade, and for the past couple of years, he's also been attending Madrasah. When he first started, we placed him in the general Ovala classroom, but soon figured it wasn't quite a good fit for him. He was having a hard time concentrating and focusing on the lessons being taught. He is great at memorizing, but following instructions, processing information, comprehending the concepts was challenging. Even with a helper teacher, he continued to struggle. Then Maulana Ehsan and Karam Nasabab, after the new Madrasah building in Chicago opened a classroom for children with special needs, it provided him with an environment to learn. The smaller class sizes, one-on-one teacher support, and the teaching methods made a big difference. Shakir had a chance to finally socialize with the other kids and feel included. The classroom offers sensory breaks as needed, and the teachers are incredibly understanding and supportive with the genuine intention to help our kids thrive. Having said that, I hope our kids are given opportunities to participate equally and feel accepted. We would like to see Shakir and other kids grow even more by providing a madrasa curriculum created specifically for them. It's important for them to understand key messages from Mullah's Waz Mubarak, relate to the grief of Imam Hussain, and receive support in every way possible. Lastly, I'm very grateful for the opportunity to share our story and hope this opens doors for special needs kids all across the community. Shukran and wassalam.
Within school and within Madrasah, so I've been working with him. So we've come such a long way. This child would run. He cannot sit still. He started biting. He was doing a lot of maladaptive behaviors, and to see him now come so far, and he is now almost completed with his Amma Siparo. So it is absolutely remarkable. So the key takeaways, we want everyone in the audience to understand is we want to raise awareness about special needs. We want to advocate for neurodivergent children. We want to reduce the stigma bias, not only amongst children, but also to help in the adult population, and especially not just with children, but with the child, but also with the family. And to get help as early as possible once these red flags are identified. Therapy is always beneficial as soon as possible. The earlier the better. You cannot understand how much what a difference that makes. Create a safe space for learning and to provide adaptive madrasa curricula, inshallah. We are going to open it up for questions.
Yeah, I'm going to ask a quick question first. So, you guys likely diagnose a lot of, there's a lot of resistance amongst parents to having their children diagnosed, as you mentioned. How do you regroup back with their physicians or connect them to get help elsewhere within the schools and things of that sort?
So I've had this happen in quite a bit in our Jamaat. I will, do that parent coaching piece. That's really important. I will explain to them that we're only here to help, and then to have me connect with their physician, I am more than happy to make those phone calls, and then to kind of guide them if they have not even been guided in the school setting because a diagnosis hasn't even occurred yet. I am there step by step. With this child in specific that Ms. Bain was talking about, I actually go to his IEP meetings in school. That is something that they have asked me to do, and so we're part of it. So I'm very familiar with that whole process, but it's a lot of just hand-holding and allowing them to feel heard. We don't, but correct. And so at least mapping it out for them that this is the steps that you need to take and kind of following up back with them via WhatsApp messaging, whatever, to know if, are they going down the right path.
So Alhamdulillah, I think this is amazing what you guys are doing for Saturday Madrasah. So my question is, in America and a lot of Jamaats, there's initiatives to create school, Monday to Friday school initiatives and projects. Some have already started, like Montessori level and Futures Elementary School. So as those projects develop, how do we address the needs of these kids in those schools? The dynamics are very different, the class sizes, the resources, the teacher ratios, and the fact that one is a Saturday, one is a Monday to Friday program, right?
Yeah, I think it's important to try to build that into the expectations of the school, and maybe reaching out to professionals that can give their guidance and try to mirror the same things that a preschool would do if they had behavioral issues. And so this is like a pilot. What Munira is doing in Chicago and what some of the BCBA are doing in Houston, those are pilot programs. And so this is really like a push to try to disseminate this information and try to create more structure across all Jamaats. So I think it's going to be something that we are doing as a trial by error, and
And then I guess a second part of that was for those kids, like you mentioned, in public schools, there's a lot of resources for these kids, right? So as we develop these Monday to Friday programs and kids go to those programs, how do we address that issue with the parents, right? They may say, in the public school, I have these resources, but if I want to send my kid to our school,
I think that if we're taking,
what advice do you give to the parents?
Well, I think if we're taking the responsibility to build a school to mimic what general education in America has, and we want to create that in our community, then we need to take the responsibility to mirror it exactly as so. And making accommodations, just like they would if they had gone to a regular school. So they're choosing to come to our school.
સગલાને ઘણું તમે લોકોનું જે પ્રેઝન્ટેશન ઘણું એક્સેલન્ટ હતું, ઘણું જરૂરી છે. અને અહીંયા આપણે જેમ ભાઈએ બી જે સવાલ પૂછ્યો એના અંદર કે અહીંયા આપણે એમના મધમાં ફરી જે આપણે આખું એજ્યુકેશનલ આજે શું છે દાવતના અંદર બી આખા જે એજ્યુકેશનલ બોડી છે એટલે આપણા પર્સનને હર શાકેલતથી જે એજ્યુકેશનના અંદર આપણે વેધર મદ્રાસા છે યા પ્રી સ્કૂલ છે યા સ્કૂલ છે યા કોલેજ છે જે બી જગા છે આજે મોલાએ એ સગલા ઇદારાઓ જે આ ચીજો છે એ સગલા અંદર વન અમ્બ્રેલા મોલાએ કાયમ ફરમાયું છે. એના વાસ્તે यहाँ એક સેન્ટ્રલ બોડી બી यहाँ બી કાયમ થઈ છે જે આખા ઇન્ટરનેશનલ લેવલના ઉપર દાવતના કાયમ થઈ છે. આ ઇનિશિયેટિવ ઇન્શાઅલ્લાહ આપણે મજમાના અંદર તમારા લોકો સાથે રીચ આઉટ કરશું અને પ્લીઝ અમને તૈયાર કરી આપજો કે જે આપણે શું છે કે આજે નોટ ઓનલી કે મદ્રાસાના અંદર પણ સગલા જે આજે જેમ ભાઈ કીધું કે આજે મોલા એમ ચાહે છે કે આપણા ફરજંદો આપણી પ્રી સ્કૂલ આપણી સ્કૂલોમાં જાય એના વાસ્તે બી આ પ્રોગ્રામ ઘણો ઇમ્પોર્ટન્ટ છે. દેવે જે સ્પેશિયલ ફરજંદો છે એ લોકો વાસ્તે બી અને જે ઘણા જે ટેકનિક્સ છે કેમ કે આજે પેરેન્ટિંગના અંદર બી આજે આપણા મોમિનીના અંદર બી આ કેમ આપણે બેટર અને ઘણા ચેલેન્જીસ આપણે ફેસ કરીએ છીએ કે જે ચીજો થી આપણા ફરજંદો આપણે બરાબરથી જે મોલા ચાહે છે તે મોલાની ખુશી છે એ મિસાલ એ લોકો જિંદગી જીવે આપણે એ લોકોને આગળ મૂવ ફોરવર્ડ કેમ કરીએ એના અંદર આપ લોકોથી ઘણી મદદ અને યારી જોઈશે अपने मजमा फरी SBA में અને આપ લોકો સાથે કોલાબોરેશનના અંદર આપણે ઇમિડિયેટલી આને ઇન પ્લેસ મૂકીએ
આપણે અમે લોકો हमारो अल्टिमेट मिशन એવું છે કે આ પણ બચ્ચાઓ મોલાના આઈંદાનો લશ્કર છે તો એ લોકોને બી આપણે શામિલ રાખે એ લોકો મહેરૂમ ના રહી જાય
just on that note sir શુક્રન કે આપે આ ચીજને અહેમિયત આપી અને anyone who's interested in this initiative please reach out to Sakina bin Munira bin after to kind of replicate what she's already done. We don't need to reinvent the wheel, but we can help you identify people who may be experts in your jamaats or support you remotely. But whoever's interested, please reach out to them after. Couple more questions.
Thank you for your talk. It was really insightful. I think a lot of parents who are dealing with this, teachers that are dealing with it, really appreciate it and then the attention to it. I know in our Jamaat, I'm in San Diego Jamaat, and it's a small Jamaat, volunteers. We don't have the expertise that we have, that you guys have in Chicago, and hopefully, we can get insight on that. But I think one of the things at a higher level, as I mentioned here, is the curriculum change. Because as you mentioned, they're on topic 1, sentence 1 of topic 1, and the class has already moved on to sections, chapter 4. And these kids are left behind, and then it's almost like they're demotivated. Like, why try? Because we're never really going to catch up. And there's no flexibility right now in the curriculum with Madrasah. So it's like you either do it or you just fail your exam, right? Like there's many kids who leave their test blank or don't know. And so the curriculum change, I think, is a huge part in addressing this problem because we can have all these things, but if we don't change the curriculum, the kids are overwhelmed. And right now, like I have talked to the teachers at our Madrasah too, and they can't change the curriculum. They're like, no, we have to do this. So
and that's okay for most learners. But I think, like Amir Baisa was mentioning, is that we, just as these learners get individualized education in the general in their classroom settings, they should also have access to this at their own individualized pace, right? So yes, that's going to take a lot of work to figure out where that child is at and what level they're at and how to teach them at their level, but inshallah, we can get those resources for them.
And hopefully soon, because the thing is that time goes by real quick. So while this initiative is there, and it might, in like 5 years, benefit the kids, what about the kids now? Because they're going to be left behind. It's like we saw it with COVID. COVID created a gap in education. This will create a gap if it takes too long.
Yeah.
I'm afraid.
Yeah.
Sorry, we're out of time. But just the energy and the interest is contagious. Please reach out to both the speakers informally as we move on to our next session. Shukran, Sabri.